My eyes are so blurry. I don't know what's going on. All right. So, workforce setting. So, we talked about all the requirements last term or last week, not last term, last week about some of the things that you needed in order to be a charge nurse in a long-term care facility. But here are some of the places. Long-term care, obviously, assisted living, independent living facilities, schools. I don't know if anybody is interested in being a school nurse. Home health nursing, mental health, military, hospital. Anybody want to join the military? Nobody. Everybody was like, no. Okay. Um, and then, of course, your hospital nursing. And like I said, you guys you have a lot more opportunities now to get into different settings. Other things, outpatient clinics and doctor's offices, urgent care centers, chiropractic offices, Veterans Health Administration, medical, hospice, palliative care, private duty nursing, health insurance companies, travel nurses, coroner's office, pharmaceutical sales, and you can even sign up with an agency. So a couple of these are really good. So I don't know, depending on where you live and what is available in your areas, I will tell you, as a veteran, okay, and I receive a lot of care at the Veterans Health and hospital and clinics and things, but um how many of you you can raise your hand. How many of you want to go back to school, get your RN or nurse practitioner or whatever? So there's some options, especially now. Things are a little bit, and I started noticing this more and more. And what I was going to say about the Veterans Administration. So I don't remember who I was talking to. This was recent, like within the last couple of days, and I still remember who it was. But anyway, we were talking about the Veterans Administration, and someone was like, "Well, they don't pay very well." And I'm like, "Okay." So I've never worked for the VA, so I don't know how they pay, all of that. But I will tell you that I have had lots of students over my years in education that have gone and worked for the VA. Their benefits are great. So educational benefits will help you pay for your school. And then you've got your medical, dental, you have all those benefits. So always look at what benefits that they're offering. Sometimes the pay may not be as great, but the benefits may outweigh that. Another thing to consider too is I've noticed this is also popping up even more and more. And I don't know how many of you have student loans after the end of your program, but a lot of places now are offering student loan. I don't know what the term is, student loan reimbursement or something like that. Basically, what that means is they'll pay towards your student loans for you. Now, yes, you probably have to work for that organization, right? For a given amount of time, but that's another option. Um, and so, just as an example, and I know this was a long time ago and I'm old, but so when I decided to go back to school to get my RN, I left long-term care. And I went to pediatrics. Okay. And I worked in a pediatric clinic that was affiliated with the big peds hospital. Now, I will tell you, I did take a pay cut. Not gonna lie, took a pretty good pay cut. I think it was like probably like $4 or $5 an hour pay cut. But what did I get in return? I got a Monday through Friday position so that I could go to school in the evenings and do my clinicals on the weekends. And it's been a long time since I've been out of peds. We'll just leave it there because I really don't even remember how long. I still have health insurance and I still have a 401, not health insurance, sorry, let me rephrase. I have life insurance and I still have a 401k with the company and they manage it still. And I haven't worked for that company in years. Okay. I can't contribute or anything, but it's still growing. They're still managing it. So again, sometimes benefits, right? And what you need at the time is something that may be a little bit different. Um, Health insurance companies. I did work for a health insurance company for a little while as well. Um, and at the time, were only hiring RNs. Get some experience as an LPN if you're interested in health insurance. That is, something that you can do as well. I personally think the coroner's office, um, I never would have thought that, I could have worked at a coroner's office. Ours never seemed to be hiring anyway, but that was also something I thought about. One of the doctors that I worked for when I worked in long-term care as a LPN, he was actually the city coroner medical examiner. Um, and he told us he was like, he if we gave him his number, if they had to do an autopsy, he would call us and let us know. We never got a call, but whatever. So I thought that would be interesting as well. But there's so many opportunities for you guys. You just have to be able to, sometimes you may have to take a position that's not your first choice, right? But it is something that will kind of help you get your foot in the door and maybe find, do your networking, get some experience, right? And then you'll be able to move into, right, the job that you really want. So some of the personal attributes, and these are just general nursing attributes, right? Being empathetic, showing concern, having emotional stability in stressful situations. Stressful situations are going to occur. Okay. It doesn't matter what aspect of nursing that you work in. Okay. Things are going to happen. People are going to get sicker than they already are. You may have to deal with upset patients. You may have to deal with upset family members, doctors, right? And so being able to stay calm in those stressful situations is going to benefit you. Now, for some, this may take some practice, right? It may take some time. Some people are more shy than others, right? And they don't know what to do if somebody starts yelling at them. And so remember your assertive communication, right? Good observational skills. So you guys did your professional development papers and you guys did a fantastic job. And I was really impressed with how you guys really sat down and looked at your strengths and weaknesses and how you can improve on them. Um, these are going to continue to improve. You're going to start to master these things as you get more exposure to clients, right? A nursing school, generally, what do you go to clinical, you may have like one patient that you're taking care of, right? And so you may not have the time management or other skills in order to work with like more than one, right? And that will come. Really need to work on developing those critical thinking and clinical reasoning skills and decision making skills. Um, you need to have comfort level in your skills within your scope of practice. So practice, 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 right? While you guys are still in school, if you guys have open labs, or other things that could potentially help you to improve your skills, take advantage of those. Um, I forgot what I was going to say. Oh, some places, especially the hospital systems, during orientation, you might have a skills lab experience as well. And like one of the hospitals that we had up in Virginia, they had skills as well as a simulation lab, okay, to help. So there may be those available to you as well. Need to be able to follow physician orders under the supervision of the RN. Again, assertiveness, being a huge client advocate is going to be something, right? That is one of our goals, advocacy and education. And then, of course, confidentiality and healthy way to relieve stress. Okay. The stress is not going to end with nursing school. Okay. No matter what you think. There's always the stress, right? Getting a job and transitioning from student to nurse. So there is going to be some stress involved in there. make sure you have some good ways to relieve stress, whether it's listening to music, talking to your best friend, um, taking a walk around the block, going to the gym, whatever it is, but find a healthy way to relieve your stress. Don't let it ball up inside. Oops. Flexibility. Oh, home health. Sorry, I missed that. Home health. Anybody like home health? I think I probably asked this question before. Does anybody like home health? Okay. Jaquan, you like, okay. Amira, you like home health? A little bit, maybe. Oh, she's not listening to
A
me.
little bit. I like one-on-one care a little bit.
Okay. Yeah. Amira, what about you? Any thoughts? So, yeah, Amira is not paying attention. Okay.
Well, no,
So,
well, no, I'm sorry. Home health
I
aid
am paying
wasn't good.
attention, Miss Jennifer. I'm shaking my head.
Oh,
who is that? No, that was Shahad. I'm not talking about you.
home health wasn't bad. It's just when you go into people houses, you don't know what's going on in there. That's scary. Sometimes people have bed bugs and bugs.
I'll be honest with you, I'm not a home health person. I thought about doing it as well. Um, and so I can't go into other people's homes, but being flexible, right? That's a big part of going into and working in patients' homes. Obviously, really good communication skills are going to be necessary, self-confidence. And so, um, this again too, this may not always be like the best, right out of school, as you're developing and improving on your assessment skills and your critical thinking and your clinical reasoning. So you have to have that self-confidence and you have to, really kind of go in and know what you need to do. Now, you're always going to have an RN, in home health that's going to be that care manager. When you go into patients' homes, a lot of times you're going to be by yourself, right? You're not going in, with a couple people. Um, Sensitivity to physical and emotional changes and ability to deal with emergencies. And again, right, because you're going into somebody's home, you're not going to have, the same equipment that you would have in a hospital should something happen, right? So you need to know what to do. Um, and another really big one, and I will always say this, is go in there and with home health, you really have to be non-judgmental, right? So kind of like I think it was Dominique is what you were saying, right? Not everybody keeps their house clean, right? Not everybody has that same level of cleanliness, right? And so um you may come across, hoarders or, people that aren't able to clean and cook and do things for themselves. But it is about being non-judgmental, right? We're not there to clean their house. We are there to make sure that they are healthy, happy, and safe. And so it may require us making some educational, right? Maybe they need to, declutter, put up some, handrails, right? Make the environment a little bit safer. But being non-judgmental is a huge part of that. So, different personality styles. And so, I don't know if anybody has ever sat down and really looked to see what their personality style is. And this is different from leadership, okay? Or, the leadership style. These are your specific interpersonal styles or your personality types. So, an analytical type, they're very detailed oriented. They can make difficult decisions even without all of the facts. They're very perceptive, but the analytical type person tends to be a little bit pessimistic. The driver type tends to be blunt, a hard worker, makes quick decisions, is independent, and is that can-do person, right? If they're going to find a way to get it done. They also tend to be assertive, distrusting, impatient. And so the drivers are also usually they are motivated by external recognition, right? So they're the ones looking for that good job, right? They want that recognition coming in. The amiable type, they're more easygoing. They like to be liked. Okay. They're not big risk takers. They kind of, want to blend in. They're very sensitive. They may have difficulty making decisions. They also can be very quiet, and soft spoken. Sorry, I told you my dog's not feeling well, and I'm like, not on the carpet today, not on the carpet. Um, And then we have the expressive type. And we all know this type of person. They are the natural salesperson, right? They could, sell you anything really, and they're storytellers, okay? They're motivator. They tend to exaggerate. They're very relationship oriented. And so I really, I know it's kind of, I think it was silly when I first saw it, but I really like the way they did it. Not everybody knows. Does everybody know who the Peanuts characters are? Snoopy, Charlie Brown. Do you guys know who they are?
Yes.
Okay. So when we look at it, um, if we look at it from that point of view, so Linus, the one with um, the why I can't, I'm like, geez. Linus is the one with the blanket. He's the more analytical type. Lucy's the driver. Charlie Brown is more amiable, and then Snoopy is expressive. All right. So that could be another way to try to remember them. But, you know, when we look at responding to individuals through those interpersonal styles, um, some people may not fit completely into one of the styles, right? They may fit into, more than one. And so that's always that, something that may happen. But the analytical type, they're like, tell me about yourself, right? Um, they speak to the point with detail. The driver type is going to be more slow speaking, more deliberate. They're going to hit the highlights. So, think about this if you're getting a shift report from these people, right? Um, so, if I'm getting report or I'm, getting report from an analytical, they just want, speak quickly to the point about what's going on with the patients. With the driver type, they want slow, they want the highlights of the shift. The amiable type, they want to have some conversation like, hey, how are you doing? How was your shift? You know, they kind of want to start off with that, just that banter back and forth. And then they'll continue, right? And then the expressive type, they'll start off with some small talk too, but then, they will leave some space, right, to allow for the conversation to continue to flow. So, little bit of difference in how they are. I am when I'm at work, if I'm getting reports, I I'm a little bit of this, like, hi, how are you? God, thanks for coming in today. So I can give a report and go home. But then I just usually will do the highlights. This is what's going on. This is what we need to worry about for your shift. This is what happened on my shift, and kind of go on about my day. Other things that you need to look at, as we are starting to look for jobs or getting ready to start looking for positions. Look now for potential references. Okay, so if you're working and you plan to leave and go into another type of environment, you have, your managers. You can also ask instructors. If, you have an instructor that, you've got a good relationship with and you know that they may provide a good reference for you. If you know me, other nurses. Um, One thing that I will tell you about references, okay? So you want to consider those that have seen you work and that they may be willing to write you a letter of, reference. In some cases, it may be verbal if somebody calls them. Never assume, and I know this sorry sounds bad, but never assume that somebody is going to give you a positive reference. Okay. If you are going to ask them to be a reference, you want to ask them, can I use you for a positive reference? Never assume, okay? If they say yes, then absolutely. Got their name, their email address, their phone number. If they say no, take that as face value and just keep moving and move on to somebody else. But again, don't ever assume that you're going to get a positive reference. And you need to take the initiative to ask for that letter of recommendation. Okay. I can tell you, not many people are going to volunteer to be like, oh, I'll write you a letter of letter of recommendation or a letter of reference. So be mindful of that. You have to take the initiative in order to get people to write those letters for you. All right, let's go ahead and take a break. Let's just be back at 3:15. I'm gonna go deal with this dog mess.
Good luck.
Thank you. Okay, thank you. And I made it before they picked up the trash. So make a double win for me. All right. So again, remember when you're looking for a reference, right? You don't want to assume anybody is going to give you a positive reference. You always want to ask, are you going to give me, will you be willing to, or may I, give your name as a positive reference? Um, and then move forward from there. So other ways, networking. So some network, smart networking of influential people can help you also find new jobs, better pay, faster promotions, and even greater job satisfaction. So you can start with family and friends, right? If they have any nursing contacts, or maybe you have friends that are already nurses and they're already working in the field, you can ask them for job leads, even names for contacts. Um, you can do personnel placement. These are good sources of job opportunities as well. So you guys have career services department, right, at Fortis. And one of their goals is to assist you in finding a job. So you can work with them. And there's other like job placement places that are out in the community as well. So that is something. I'm sorry. Can anybody hear me? I'm not muted. Okay. Um, so there's like, employment centers and stuff that you can look for as well. And then of course there's the social media sites. Okay. When you look at social media sites, there's a variety of out there. So LinkedIn is a big one. Um, LinkedIn is a professional social media site that can help you find mentors. It can help you stay in touch with, your favorite teachers, find managers and recruiters in your job field as well. And so, it's another site. They also have some really good information on LinkedIn about interviewing and um, networking. So LinkedIn is a really good site as well. And then of course you have Indeed. Indeed's a job board. There's other ones like Simply Hired. Um, there's another one. What is it? It's on the tip of my tongue now. I can't remember it. But there are other internet sites as well. So you can post your resume on Indeed. You can even, I think for both Indeed and LinkedIn, you'll put on there like you're open for employment. And so if people are looking for, those with your skill set, and they just do a search either through LinkedIn or Indeed, your name could pop up. So that could also be something that's potentially helpful to you as well. I mean, there's a lot of places that advertise for positions on Indeed. So always a good way to do it as well. And like I said, networking is also a really good way. And then informational interviews. So what does an informational interview sound like? I hear crickets. Um,
Can you repeat the question?
yes. What does an informational interview sound like?
Just somebody giving you information on a company you thinking about working for.
Yeah, I
Yeah.
was.
There you go. Exactly, right? So it doesn't always have to be with the company that you look like. It could just be a field that you're interested in. So let's say you meet um can't do it during a clinical, but maybe you meet a nurse that works at one of your local hospitals and you're able to initiate a conversation. Okay, so, you can kind of just get some insight about where they're working, what they do. Um, and it's not like you're not sitting there asking them for a job, right? You're just trying to, get a feel for what's out there and get just some additional insight. When you are networking, okay? And so if you are using, um, what do you call it? Like LinkedIn or Indeed, or, any of the other professional networking sites, um, or just networking in general, always be positive with everyone you meet. And so I know that probably, and I'm just going to say probably, somewhere along in your clinicals or in some of the others, you may have met some nurses that are not so positive, okay? Um, and so always be positive. Get input from your supervisors and other nurses on how to build your career. Ask them, there's someone that you particularly click with, ask them to be your mentor. Okay. And so they may give you, some ins and outs, some things that you can do to enhance yourself, right? Make yourself more visible to employers and always build relationships with key people where you work. And I don't mean, it's you obviously you want to go in and you want to do your job, but you also want to build relationships, managers, supervisors, administration. Be willing to lend a hand without being asked and mentor others. This is a big one, and I think I've probably said this before in this class. Nursing is not an individual sport, okay? It is a team sport. How many of you are any of you CNAs right now? Is anybody a CNA? We only have a couple. Okay. So CNAs understand, right, what it's like to have to carry the weight of the world on their shoulders, right? They have a lot of work that they have to get done within their shifts. All right. If you are sitting at the nurse's station and don't have anything to do at that moment, but you see the other nurses, you see the other CNAs running around because, maybe their patients aren't as stable as your patients, be willing to get up and help. You don't need to, don't wait for somebody to ask, show that initiative. You can also ask about facility committees to participate in. So I know we talked about continuous quality improvement. That's always a big one. There's other committees that, you may be able to join. That also will help you to network, right? Depending on, especially CQI, you're going to meet, people from other departments, other units. So that's a good way to network as well. And then if you're able to join professional and community organizations, right? So those nursing organizations, those are additional networking sites for you. So I'm a member, oh my gosh. I am a member of the American Nurses Association. And so, under the American Nurses Association, I have honorary membership through the Texas Nurses Association. I'm also a member of Sigma Theta Tau International. Okay. And those two, they will um, send out, job announcements and other opportunities that are available. So the more you put yourself out there in a positive light, okay, then you may be, get some more opportunities open to you. So we have resumes and the application process. So again, um, you have your career services person at your campus. Okay. And if they haven't asked you to send them your resume yet, they probably will very soon, right? And so they're there to also help you build your resume. But these are just some tips for your resume that you should, pay attention to. So always, professional discipline when you are writing your resumes. All right. So there is a figure 18.7 in your success book. Um, Cover letter, there's also a sample cover letter. Now, I will tell you that a lot of places now are asking for cover letters. And so have a cover letter prepared. And for new graduates, you want to highlight your academic and clinical accomplishments. Um, and then application questions. All right. So if you're going to, fill out an application online, they're going to ask you questions, you know, um, like I'm just going to go straight forward. Like, do you have, have you been convicted, of, I forget what the questions are, like of, anything that would negatively affect your background report. Don't don't falsify these answers. Just be honest and truthful with them because they're going to find out. So one thing being a nurse, okay, I'm just letting you know, and I actually had this happen to me once back when I first started in education. We were, getting at the end of the term and they were filling out their board of nursing applications and someone checked no that they didn't have anything on their background check. And you have a federal background check run, right, with your board of nursing application. And of course, they flagged flagged that application. And that person had to go before the board of nursing, before even sitting for NCLEX, okay, in order to plead their case and get permission to sit for NCLEX. Okay. And they had to answer, why did they lie on their application? Okay. That was one of the first questions that they asked. So don't ever falsify information. You will be given an opportunity to explain. Okay. So your basic resume, 2-page maximum. Okay. I will tell you as a former leader, um, once you start getting into anything more than two, it really, don't need all of that information and it starts to get redundant and a lot of people don't even, read that far in, down. So you want as much. One page is actually preferred, okay, but 2-page maximum. Make sure you're using quality paper, either white or off-white. No designs, no textures, no big, picture of yourself in the corner. Okay, you want this to look professional. Okay, so again, no designs, no textures. And then if you're using, um, if you have a cover letter, a resume, and an envelope, you kind of want them all to match. So use the same color, matching paper. You want to use the proper font. Okay, so typically with professional writing, we use Arial or we use Times New Roman. All right, those are your typefaces. 10 to 14 point is preferred. You can use italics. You can use, underlying in some cases, but just be very careful, okay? If you've ever tried to read something that is all italicized, it's very hard to read. You can bold though. So for example, on my resume, I bold to like my job, right? So like Fortis College would be bold, okay, and then underneath that, like my date of employment and then my job description, like what do I do at Fortis, right? So be very careful with that. You don't want columns. You just want it in a nice land, you don't want it, you don't want landscapes, you want it in the, what is it, the portrait style. Um, like I said, be careful with your typeface and your fonts as well. Always use spell check. You would be amazed how many people write resumes and don't look at spell check or grammar check. Um, and that just makes you appear unprofessional, right? That you don't care. So always use spell check and grammar check. Now, your resumes can be, sent to people in a variety of ways. So you should always have a hard copy of your resume or a couple copies of your resume if you're going to apply for jobs online, like through LinkedIn, Indeed, or another job board, always have an electronic version as well so that you can attach it when you're submitting your applications for those. Don't fax your resume unless they ask you to fax the resume. Okay. And just kind of make it, nice and balanced. You always want to emphasize your strengths, okay? Doesn't matter if you have a long work history or maybe you've just been a student up until this point, right? You want to emphasize what are you good at, okay? When people are reading resumes to look to hire somebody, they're really looking at what you can offer to that organization. Okay. And so you really want to highlight those strengths. When we look at illegal questions, and I said that right, illegal questions. Okay. Yeah, illegal questions. Just want to make sure. Um, These are questions they're not supposed to ask you. All right. But there could be potentially, they may ask you, um, have you been hospitalized within the past 5 years? Okay. So, you don't have to answer it, but if you choose to answer, you can just say, I don't have any health problems that would interfere with fulfilling the described position. Have you ever been on workers' compensation? So you can either say, that's not applicable, or you can say, I am able to perform all of the described job duties. Do you have a criminal record? Now, I'm telling you again, be honest and factual. Okay. So, like here it says, I received a speeding ticket, but I've never been convicted of any misdemeanors or felonies. Be honest and factual. Okay. And I'm here to tell you, not all felonies, not all misdemeanors are going to disqualify you from getting your nursing license or from getting a job. Okay. But again, you want to be factual, you want to be honest because, again, they're going to do that background check, they're going to find it. Okay. And if they show that you lied on your application, right, that's a strike against you and you don't want that to happen. Getting ready for the interview. So, who's heard from career services? Anybody? Nobody has heard from career services. So,
So they supposed to be doing a like a career day.
mhm.
That's what we heard though.
Oh, okay. Jamalatu, where'd you go?
Where it is.
Jam
Yeah.
Jamalatu. Okay. So preparing for the interview, if you've, I look, I don't go on interviews very often. If I had to do an interview, I'd probably be a nervous wreck. Okay. So you want to make sure that you are prepared as possible when you are going into um, an interview. Okay. So just as, rule of thumb, when you are going to go to an interview, you need to make sure that you um, do some research on the company that you're interviewing with. So, look at their mission statement, look at, the programs they offer, understand a little bit about the organization. Are you going to know all the ins and outs? Absolutely not. Okay. But you want to get as much information as you can from that organization. So, also, another thing that is really employers want you to be interested in them. Okay. So, what I mean by that, um, you're going to have when you go in for an interview, they're going to throw a whole bunch of questions at you, right? They're going to ask you questions, about, maybe your experience or why you want to work here and other things. Have questions prepared for the interview as well. Write them down on a piece of paper. If you go in with a portfolio or, a notebook or something, have questions written down. Okay, so some of the things that you could potentially ask about scheduling process, ask about the clientele that you're going to work with, how many beds are in the facility, what is the nurse to patient ratio? That's always a big one. I want to know. I want to know what the nurse patient ratio is. What are the shifts? Are they 8-hour shifts? Are they 10-hour shifts? Are they 12-hour shifts? Do you stay on your unit? What's the float schedule? What's the word I'm looking for? The support for new hires. Are you going to get a preceptor? Are you assigned a mentor? How long is orientation? Trying to think of what else. What type of EMR system do they use? Right. So these are just some questions that you can have, ready to go. Now, I'll tell you, a lot of times, if they're talking about the company, they may provide all of this information, right, in their conversation with you. And you can, kind of say, hey, and these are some of the questions, and you've already asked, you've answered the questions that I've had. Um, so other two is your competency testing. So I will tell you, this was again when I was a brand new baby nurse. I went to apply for one position and there was a dosage calculations test that I had to take. And it wasn't 10 questions. It was, oh, it wasn't all dosage. I will tell you that. It was like maybe about 30 dosage questions and then a whole bunch of questions about IV medications. Like I want to say it was like 100-question test. And I passed it probably by the skin of my teeth. But it was extremely overwhelming. I was not prepared for that. So kind of knowing, right, what the expectation is. Um, and then some of the things, that, you know, um, they may, they're gonna, of course, gonna ask you a whole bunch of questions as well. So the one question that I know the one question I just, like, why? I'm like, tell me about yourself. Um, so I will tell you, um, most interviews really they just want to know about your experience, right? What's your experience, your work history. I actually went into an interview one time and I asked the question, I said, do you want my work history or my personal history? And they were like, oh, we want your personal history. Like, where were you born? Where did you grow up? Why did you want to be a nurse? And I was like, so I had given them like a little mini biography of myself before I even got into my like nursing stuff. So be prepared, because, it depends on what they're looking for. So have something a little bit, more open. If they've asked if you've ever done this type of work before, and you haven't, just, hey, I went to nursing school and we did this in clinicals, so you do have some experience, right, that you've gained through your clinical experience. Another one is, why do you want to work here? And this is why I say, look up the mission statement. Um, Look at their reviews. I never, and when I first started, I sound so old, okay, but we didn't have a whole lot of internet, right, when I first started in nursing. And so there wasn't a whole lot of like resources to look for, what's the word I'm looking for? What reputation were, what they're, how like, are they a 2 out of 5 or 3 out of 5 or 5 out of 5, right? You have that opportunity now, right? You can see what the reviews are for the organizations that you are working with. Okay, you want to read, like I said, you want to look at their mission statement, and you can, and that's, a good way to start. You can say, I reviewed your mission statement. It states this, and this, aligns with my, beliefs or my views, right? And kind of go into how that does. Um, so that's another one. What motivates you? This is always another tricky question. And so, look at, what it is, is it going in and just doing a great job, improving your skills, right? Continuing to grow in nursing, right? Whatever it is that is going to motivate you. They also may ask like why you left your last job, when you're available to start, what are your 3 greatest strengths and 3 greatest weaknesses? They also may have, your goals, right? What is your 5-year plan? Where do you see yourself in 5 years? So lots of different questions that you could, be asked. And what is it, 1812 in your book. So there's that's going to kind of give you some good help. There's also the STAR method. And this is something, and you can prepare for these questions. You can even Google. Um, this was like forever ago. But I had a student that was actually applied at the VA. And so the VA hiring process back then is a lot, I think it's a lot different now, but back then it was pretty intense. And you can Google sample interview questions. Okay. So you can get an idea of what are some other sample questions that are out there. But your STAR method, situation, task, action, result. That was what you should use to answer example questions, such as describe a time you dealt with a difficult client. So, what was the situation? What was the task at hand? What did you do? And what was the result? Some people talk a lot, some people don't talk enough. So using that STAR method may help to, get your thoughts together, and you can have some of these, situations ready, right? You can, think about them prior to going into the interview, rather than having to always come up with something on the spot. And then make a lasting impression. So we know that, it's been said that an initial impression is made within the first 30 seconds of meeting someone. So when we, are presenting ourselves, okay, so make sure that, personal hygiene, good hygiene is essential during, for your interview. Make sure your hair is like a moderate style. um Makeup. um you can wear makeup that is not anything that should You don't have to, but I would just be careful with makeup, make it conservative. Remember, you're going into healthcare, so like the eyelashes and things like that, make it more conservative. Um, and then you want to be confident, okay? Stand up straight, hold your posture, right? You don't want to be slumped. Sit up straight. They ask you to sit, right? You sit up straight in the chair and be courteous, be kind. If you are a smoker, do not go into an interview, especially in a healthcare facility, smelling like cigarette smoke, okay? So be mindful of that. Um, you obviously want to wear deodorant. Um, don't go in with a whole bunch body sprays and perfumes as well. One thing that within healthcare, people may be allergic to certain scents, right? Or it could just be overwhelming. Trying to think of what else. Nails. Everybody loves their nails. Most healthcare organizations also have nail policy. Most of it is, right, no acrylics, no fake nails, neutral color nail polish. Whether they choose to enforce it or not, the policy, I promise you, probably exists. So always do short nails, clean, nicely manicured. I would again avoid the long fingernails, the fake nails. Um, and then, like I said, go in and be confident. Um, I will tell you, I'm a fidgeter. I don't know, you guys probably already know that because I'm always turning in my chair. I am a fidgeter, 100%. I told you I talk with my hands a lot. And so I have had to, in the past with interviews, I have to be really careful, because I am a fidgeter. And so if I can't move my hands, or move myself. I will, find other ways to fidget, and it probably is just like so annoying to people because I know it's annoying to me. So if you're a fidgeter, have something. One of my biggest, what's the word I'm looking for? Saving graces is I always carry a pen. Okay. And I don't sit there and click the pen because, I don't know if anybody likes that, but that would drive me crazy. Okay. But what I do is I go in and I have a pad of paper and I always have a pen. And so I can hold the pen in my hand, right? And I can move the pen around, not a lot. Or I can squeeze the pen, right? So that helps to get rid of some of that nervous and energy. So if you're a fidgeter like me, you may have to get a little creative because you don't want to sit there and fidget in an interview. And then, excuse me, after the interview, follow up is absolutely essential. Okay. So, and as someone again who has been in leadership that has hired people, Um, a lot of people don't follow up after an interview, right? They'll come in, they'll do the interview, they'll express interest, and then, there's of course a process for hiring people, and then you just think, they don't ever follow up to see if they got the job. So, or even if they were in the running for the job. So, they're kind of pushed aside and we'll find people that are really interested in getting that position. So always follow up. And so let's say your interview is at 10 a.m. All right, you go in for your interview. Maybe you go get yourself something to eat afterwards. You go home, send a either a handwritten or an email thank you note that same day. Don't wait till the next day. Don't wait for a week. You want to send it that same day, especially if you really want that position. Okay. The more often that employer hears your name, okay, the better your chances are of getting hired. So something as simple as, you know, hey, dear Mrs. Martinez, thanks for taking the time to meet with me today, to discuss the whatever position, okay? And then you can say like, after, discussing or having the discussion about the job duties and the responsibilities and the tour of the facility, I feel that I may, be an asset to your organization. Okay. Or I'm really interested in working for your organization. Um, and so again, you want as much exposure as possible. And so again, I remain interested in the position. And then provide a follow-up time, like when you are going to follow up with it. And this isn't pushy, I promise. Most of the time when you go in for an interview, right, they're going to sell you. Usually at the end of the interview, they'll be like, okay, um, we are in the interviewing process and we hope to make a decision by this day. Okay. So you can say that you will, in your thank you letter to them about the interview, you can say, okay, I know to follow, I will follow up with you on this day to see whether or not you have made a decision, right? Plain and simple. But you want to make that thank you letter that same day. Again, you don't want to keep pushing it off. You don't want to wait. Oops. Another one right here is resignation with style. Okay. Don't burn bridges. Okay. Especially in healthcare. Healthcare, although there's a lot of nurses and a lot of hospitals and a lot of facilities, nursing is a small world. Okay. You would be amazed at how small it truly is. Always when you resign, always resign respectfully, even if you didn't like where you were working. Okay. You don't want to be like, um, you see some of those like things on TikTok and stuff, like, written on a napkin and I quit, right? And you walk out. No. Always write a letter, okay? And you always want to like say, you know, um, so I'm writing oh my gosh, my brain just went or please accept my resignation as of this date. Most organizations have 2 weeks notice. Okay, so you have to look at what the policy is, the wherever you're working. You want to make sure that you give that 2 weeks notice and say something positive about the organization. I learned a lot while working, doing blah 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 blah. Okay. Um, don't don't leave on a negative note. Okay. You want to do things properly. Your new employer, see, this is where ethics comes into play. Your new employer should respect the fact that you need to give 2 weeks notice to your current employer before you start working. Okay, that's just a mutual respect. Um, Now, most states are at will states, so you may put your 2 weeks notice in and they may come back and say, okay, well, thank you. Your services are no longer needed, right? So there is that option that can happen, but you always want to always resign respectfully so that you never burn a bridge. And you never know what's going to happen. You never know. You may at some point need to go back to that organization and work. So just always do that. Um, and then before we go into the transition to practice model, I know there's a few people that need to use the restroom and things. So let's be back at 405. All right. So we have the NCSBN transition to practice. So the National Council of the State Board of Nursing, okay, NCSBN, they're the ones that write your NCLEX, okay? So it is an effort to um increase retention or so. Yeah, so it's a way to increase retention and employment, improve client outcomes, and transition from being a student to being a nurse. Okay. So a trained nurse or preceptor is there to assist the new grad apply theory to practice, develop clinical theory or clinical reasoning, improve safety, and decrease practice errors in the care of clients. And so there's 5 online modules of study: communication and teamwork, client-centered care, evidence-based practice, quality improvement, and informatics. And so there used to be like some residency programs and other things, but this was a big one. The transition to practice model was developed, and it's had some really good outcomes. Now, I'm not sure how many organizations actually have a transition to practice. But again, this is a really good way to assist those new grads in transitioning, right? Developing those needed skills in order to effectively and safely practice. So this is another thing too, if you look at where you are working at, where you want to work at, to see if they, sorry, um, if they offer something like this transition practice, because it will definitely assist you. Other things, that you can do to help yourselves as well is joining those professional organizations. So the NLN, which is the National League of Nursing, membership's open to all levels of nurses. It's focused on meeting the needs of nurse educator. So it eventually, it does help to advance the health of the nation. It also helps, one of the big things that one of the big things that the NLN does is setting standards that advance excellence and innovation in nursing education. So that, but again, it's open to all levels of nursing. The American Nurses Association only represents registered nurses. Some state affiliates allow LPNs or LVNs to join at the state level, but not at the national level. So you can look into it. There's NAPNES, which is the National Association for Practical Nurse Education and Service. This been around for a long time. It includes LPNs, RNs, as well as students. So that is something, right? Even schools can join NAPNES as well. So that is, again, something that you can look into is joining those professional organizations. So like if you join NAPNES, you got a journal subscription. And then if you go on the website, it'll show you about certification. There's news and updates. There's articles. There's CEUs on NAPNES as well, webinars, and they even do job postings. You also have the National Association of Licensed Practical Nurses, or the NALPN, NALPN, I said that right. That is the policy making body for LPNs. So again, now I'm going to tell you, you do have to pay in order to be a member to these organizations, but they do provide some really good stuff. Then we have continuing education. So remember I said probably, I don't remember what week it was. In order for you to renew your license, you may have to have continuing education units. CEUs are different than in-services, okay? A lot of organizations, when you go to, go to work, wherever it is that you're going to work, you will have to do a bunch of in-services, okay? The in-services meet the needs of the facility that you were working at, okay? So, for example, bloodborne pathogen training is something that you will have to do every year, no matter where you work. Fire safety. Um, what else? Of course, now I can't think of anything else. But there's a bunch, right? HIPAA, confidentiality, patients' rights. So there's usually a bunch. Those are in-service trainings. They may not count as CEUs. Sometimes they are, it just depends on the content, okay? But your continuing education, your CEUs, you have to have a certain amount of hours every year in order to renew your license. Workshops are also workshops, they may be offered within your organization as well. It just helps to, they give information, then you get a chance to practice what you were taught. So it does help to, learn new skills. Um, and then, so I talked about the continuing education units. Again, always check with that board of nursing to see how many CEUs that you need in order to renew your license. And if you join like the NLAPN, they will offer some, CEUs. Um, there's other organizations out there that will offer CEUs as well. Certifications. So as a LPN, there are certification programs that are available to you. So the long-term care certification, you can actually get a pharmacology certification, you can get an IV certification. So you can look at NAPNES, the National Association of Practical Nursing Education Services, right? You can look at their website that will provide you the information needed in order, like what are the qualifications to sit for certification? It is an exam. All right. So like for long-term care, for example, you have to have at least a minimum of 1 year working in long-term care in order to sit for the long-term care certification. So all of that information can be found at NAPNES. Same thing with the IV certification. I'm not really sure, or is it IV? Yeah, no, they're all on NAPNES, but the NLAPN also offers some certifications as well. So you can look at both of those to see. Um, and again, the NLAPN, that's the that voice of the practical nurse. Talked about those. And then registered nurse. So the registered nurse career pathway obviously is a little bit different. Um, the if you want to continue to go and continue on with your education, right? um you've looked at job opportunities in your area and you find that jobs for LPNs are limited. The salary difference is also something that you can look at between LPNs and RNs. Your current, this is what I say, look at your benefits, okay? Your current place of employment will assist you in paying for schooling. And then, of course, you'll have the expanded responsibilities in that RN role. So, like I said, there's a variety of different benefits out there for you. So, I was saying that some are helping to pay off student loans. I mean, it's not, I don't know, each organization is going to be different in how they do that. Just trying to remember. So my daughter is actually doing that now. Um, I don't know if she didn't know about it or if it's a new program that they started to offer. I think it's a new program that they started to offer because she's been with them for 10 years. And so she went ahead and started doing that. So they basically, I forget what the max is, but they basically pay her student loan every month. And then she also makes the payment to her student loan, right? So it'll get paid off faster. So that's one of those benefits too, right? When you're applying for jobs that you kind of want to look at to see if that is something, that they offer, and, potentially help you out as well. Because we know student loans, I'm still paying on my student loan. They can be very expensive because they want their money back. So, all right. So, any questions on chapter 18? Questions? All right. So, I told you guys that you would be able to pick your questions for today. So, I will share my screen. I'm going to show you what your options are. Oops. Where'd you go? There you go. All right. So we could do it by chapter. I've never done it by chapter before, but there's fundamentals, there's respiratory cardio, LOC, pressure injuries, dementia, diabetes, older adults, GI and nutrition, infection control, fluid electrolyte and acid-base balance, the LVN and rehab, long-term care, urgent care, med surge, postpartum peds, there's pharmacology, and there's medication administration. Or we could go and we can pick one of these. Assignment or multiple. Assignment, delegation, prioritization, priority, and supervision. Anybody have an idea for a topic?
Priority.
Priority? Just priority, or do we want to do any other ones?
Delegation.
Delegation. All right. Let's do, we got 25 minutes. I will start. We'll start with, actually, I'm going to start with 25 questions. And, yep. Because we may have done, it has a total available of 54. So I'll do 54. Let's see what happens. Because we may have done some of these questions. So we may skip some. All right. So you can answer out loud or you can answer in the chat. Oh, we already had this one. I already know that question. Okay, so here we go. So the nurse is assisting the critical care RN in the intensive care unit with a mechanically ventilated patient. Which intervention by the nurse is a priority to prevent ventilator-acquired pneumonia? 1, suctioning the endotracheal tube every 2 hours. 2, administration of prophylactic antibiotics. 3, oral care with chlorhexidine every 2 hours. Or 4, positioning the patient in a prone position. So again, you can answer in the chat or you can answer out loud. All right, Shahada, what do you think? Ashley, what do you think? Linda, Ramella, please turn your cameras on.
Is it 3?
You got 3? Okay. Linda. Linda, turn your camera on, please.
You had asked me. I was looking. I'm sorry. Let's say what? Which intervention by nurses priority prevent? I would say let me look at the answers again.
One.
Who
I
said
would
one?
say one too. Yeah, I was going to say one as well.
Yeah, I
Okay.
said one too.
All right. We have some that are not answering.
Did you hear me? Does she want everybody to like
I heard you, Shahada.
Do you want everybody to mute and say it?
I said you can either do it in the chat or you can come off mute and say it. So either way is fine. All right. So let's see. I'm counting the answers. So
D,
I'm counting the answers to see who's got which. All right. So
D,
the majority
D.
has 3. All right. So the correct answer is 3.
Who's on that? Who's on me and you so?
Chlorhexidine. Has anybody worked with chlorhexidine? So chlorhexidine, so we'll do like chlorhexidine bath. Any of my CNAs given a chlorhexidine bath?
Is
Dominique,
that
yeah.
the one that's like before surgery?
Yeah, we do it before surgery. We'll also do so if anybody that has like a central line, a PIC line, I'm trying to think of what else. But yeah, surgery, we'll do it before surgery. And it's a mild antiseptic, okay? So it's tried to, help prevent bacterial spread. But there is a chlorhexidine oral care that we can do as well that helps to reduce VAP. It's part of the ventilator bundle. So think about when somebody is intubated, okay? So I have a pen. That's all I have is a pen, okay? If I'm intubated, I have a tube coming out of my mouth, right? Okay. And so what does that mean? My mouth can't close all the way, right? Because I have a tube coming out of my mouth, okay? So, and it's going directly into my airway. So any bacteria, stuff in the air, right? That has a straight shot too, right down into my airway. So the chlorhexidine, being that it's that antiseptic, right, can help to keep that mouth clean, bacteria free. Um, we already did that one. We've done that one. So that's why I chose all of the questions. Um, we did that one. Okay. So the nurse is assigned a patient with COPD and hypertension. The patient's wife asked the nurse what could have caused her husband's illness. Which risk factors are significant when the nurse considers the etiology of COPD? So this is the select all that apply. So we have smoking, we have working as a firefighter, living in a dry desert climate, being overweight, being over the age of 50, and a low protein diet. What are some of the risk factors for COPD and hypertension?
I would say one, maybe two, because as a firefighter, you would have like that smoke inhalation.
3.
4
We got 3. I heard a 4. Okay.
and 5.
And then 5.
Yeah,
Okay.
because over 50 could cause it as well.
I'm sorry, I didn't mean 3, I meant 4.
Okay. Oh, you didn't mean 3, you meant 4. Didn't
I
any?
think maybe only 1 and 2.
Okay, so we got 1, 1 and 2. Others were got 4, 3, 4, and 5.
No, the person that said 3 said they didn't want to choose
Said
3.
no. Okay, I'm
Yeah,
sorry.
Linda said 3.
I'm sorry.
I
I
had said
agree with
1,
one,
2,
two,
4,
and
and
four.
5.
I
Okay.
did 1, 2, 4, and 5.
Okay. All right, so we're gonna skip 3 and 6. Let's see. What did we do? All right, so just 1, 2, and 3. So smoking, of course, we know, right? That's going to be one around the biggest causes of COPD. So about smoking is a cause of around 90% of COPD risk. Persons who live in dust-filled environments or have occupations that have exposure to dust, fly ash, soot, smoke, aerosols, and fumes are also considered at high risk for developing COPD. So, working as a firefighter, obviously, right? Smoke, ash, soot, um, fumes, and then that dry desert climate as well, right? That dust. Good job. All right. Um, we already did this question. Let's see. We did that one as well. We did that one. We know we did that one. That's why I picked all of them. Did that one. Okay. Which actions can the nurse safely delegate to an assistive personnel when caring for a patient at risk for pressure injury? Um,
One.
turn and re okay, one. We have check and record vital signs
2
every
and
4
4 and 5.
hours.
1,
1, 2,
4 and 5.
4,
4,
and
and
5.
5. Okay.
Yeah, that's all.
All right. Sorry. All right. Let's see what it is. Dun, 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 dun. Very
Oh,
good.
I was. Oh, wait, never mind.
She's like, no, wait, never mind. So yes, go ahead.
No, I meant to mute it.
Oh, so yes, the AP scope of practice includes basic patient care and assistance with activities of daily living, as well as checking and reporting vital signs and reminding or encouraging patients about information already taught by the nurse. But then the nurse is responsible for assessing and administering medications. Very good. Um, we did cover that one. Okay. The nurse is assisting with the admission of a patient from a long-term care facility who has a stage 4 pressure injury wound. Which actions or interventions will the nurse delegate to the experienced AP? So help move the patient from stretcher to bed, orient the patient to unit policies, take the temperature, assist the patient in changing into a hospital gown, assessing the wound, or checking the patient's oxygen saturation.
1, 3, 4, and I guess 6.
All right. Everybody good with that?
I would say number 5 as well, because if they're getting admitted to a long-term facility, I think
But
if they're
What is
experienced,
it? That's Ashley.
this
yeah,
is
when you admit and you assess them.
right. But
Yeah.
this is delegation.
This is
We're
delegation.
asking the AP to do it.
Oh, okay. All right. Okay.
Got it? Yep. So,
Yeah.
yep. The nurse delegates care that is within the AP's scope of practice, such as repositioning, checking vital signs, and assisting with changing to a hospital gown. They should know how to do the oxygen saturation as well. But then the nurse is responsible for ensuring the AP knows the skill. Assessing and orienting are more complex skills that should be completed by nurses. Let's see. Oh, um, we did that question too. All right. Um, Which action can the nurse safely delegate to the experienced AP when caring for a patient with diabetes who develops symptoms of hypoglycemia? So, administer IM glucagon, check a finger stick glucose, draw
Number
up
two.
insulin into a syringe, or give IV dextrose.
Two.
Two.
All right. Yep, they can definitely do that. Okay. So an experienced AP would have been taught how to perform a finger stick blood glucose test. Um, okay. The AP is assisting a diabetic patient with his bath. Which priority instruction would the nurse be sure to provide? One, check the patient's blood pressure before and after the bath. Provide the patient with a snack after his bath is completed. Assist the patient back to bed after his bath is completed, or report any breaks in the skin seen while assisting with the bath.
Would it
Four.
be 4? Yeah.
Yes. Remember, we talked skin assessments, skin assessments, skin assessments are so important. Doesn't matter if they're diabetic or not, but any break in the skin can increase their risk for infection and should be noted and treated as soon as possible. And
Miss Martinez, what is this? The Saunders questions?
no, this is prioritization and delegation.
Mm-hmm. What is it from though? Like what is Elsevier?
Yes. It's prioritization and delegation.
Okay.
Okay. A patient is being admitted to the med-surg unit from the post-anesthesia care unit following a laparoscopic cholecystectomy. Which post-op duties can the nurse safely delegate to the AP? Select all that apply. Place them in a semi-Fowler's position. Measure vital signs every 15 minutes for an hour. Note the color and consistency of T-tube drainage. Empty and record the amount of T-tube drainage. Note the condition of the abdominal dressing, or question the patient regarding pain. I like this because they didn't use those key words, right? So what's a cholecystectomy?
That's the gallbladder removal, right?
Yes. Gallbladder removal. Yep.
So maybe 1 and 4.
So one,
I
somebody
agree
else
with
said
that.
two. I'm sorry, anything
No,
else?
I did. Who said 2?
Oh, I have it in the chat.
Oh, okay.
Yep.
Um, could we do 3 as well? Note the
Three.
color and consistency of the drainage.
Okay. One. Just making
Maybe
sure I got
6.
everybody's answers. I'm just making sure I
Mm.
got everybody's answers. All right. So we can do 1, 2, and 4. So positioning, vitals, and emptying and reporting drainage are what we can do. So this right here, when we use the word note, what is that?
Is that like documenting?
Assessing,
Okay.
right? So think of it, noting the color and consistency would be an assessment, right? What color is it? What is its consistency? Same thing for the abdominal dressing.
Mm-hmm.
Now, questioning the patient regarding pain level, right? That really
Yeah.
should be done by the nurse, right? Only because, it's kind of an extra step. Like you would have to tell, first you would have to tell her that, yeah, I'm in, or him or whoever, the AP, that I'm in pain. Then the AP has to go tell the nurse. Then the nurse has to go pull the meds, right? It's a whole, but that nurse should be doing that as part of that assessment as they're being admitted. Um,
I
Okay.
get confused with that because in the real world, it's like they do ask you sometimes to ask the patient about their pain level, even though it
About
is an extra
Yeah,
step.
and or a lot of times if, the CNAs are doing rounds, they may tell the CNA that they're in pain, right? And that
Mm-hmm.
they need pain medicine.
Yeah.
All right. The nurse is making assignments for an AP on the medical surgical unit. Which nursing task can safely be delegated to the AP? It's a select all that apply. So one, application of warm, moist compresses to an infiltrated IV site, transferring a patient with a gastroscopy tube from the bed to a chair, administer an enema to a patient who is constipated, administering a tube feeding to a patient with a duodenal tube feeding tube, discontinuing a urinary catheter in a patient who had a fever, or performing oral care on a patient with a non-rebreather oxygen face mask. Oh my gosh, that was like a tongue twister.
Maybe one.
Okay, so warm, moist compress to IV infiltrated sites. All right, Jamalatu, what do you think?
I want to say 3 and 6, maybe two, two, 3.
3,
I'm not
6,
too really sure about the enema, but I want to say 2, 3, and 6.
2, 3,
I
and 6.
wouldn't say three because what if it's impacted? I mean, I guess they're not saying that, so it doesn't really matter.
So an enema is considered what?
What do you mean?
What is an enema?
It's not medicated, right?
But
It's a
you're
process.
inserting an
There's the question.
anesthetic.
Is it a medication or is it not?
No, it's non-medicated.
Okay. So we have, I'm looking at
Maybe,
everything
maybe
here.
number 2, the transferring. Yeah, definitely number 2.
So we got 2, 3, and 6. Everybody's pretty sure about those. Any other ones? Or are we going to go with 2, 3, and 6? All right. I'm clicking submit. All right. What can we do? 1, 2, 3, 5, and 6. So, yep, we can do the warm compresses. We can transfer with a gastroscopy tube. We can give the enema. We can discontinue a urinary catheter who has a fever, and we can do oral care on a patient with a non-rebreather oxygen face mask. I don't know why that's a tongue twister. But why can they do this skill? And I just throw a whole wrench in it, right?
I didn't think they could or were or you had the knowledge of knowing how to.
So they can't put one in, right? Because it is a sterile procedure.
But to take it out, don't you have to inflate the balloon and stuff like that?
You have to deflate the balloon. Yes.
Yeah. So
We would, yeah, basic. So you got to remember this is where NCLEX may be different. Um, this may not be in all states, right? That they can do that, right? So you have to know what the national guidelines are. But yes, they can discontinue a catheter. They just have to, basically they just deflate the balloon and pull the catheter out. But it's not a sterile procedure, so it is something that could be within their scope of practice. But yeah, so they can't do tube feedings unless it is allowed by their state and agency policy. So that is something also that we need to look at. I think we have time for one more. Um, I don't know if we've had this question or not. All right, so under nursing supervision, which actions related to the use of safety devices, restraints can be delegated or assigned to assisted personnel? So place familiar items such as family pictures near the bedside. Explain the reason for the device to the patient and the family. Assess skin and perform neurocirculation checks every 30 minutes. Assist with toileting every 2 hours or as scheduled. Assess and document behaviors related to the need for devices. And use a half bow or safety knot to secure the device to the bed frame. So we got a 1, a 4, and a 5. AP, 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 AP. I'm unclicking that one because it says what?
Assess.
So we got 1 and 4. Is there anything else that the AP can do? Someone said 6. So I'm going to add 6. All right. Submit. Very good. Yes. Place familiar items such as pictures near the bedside. Assist with toileting and using a half bow or a safety net. Oh my gosh, safety knot to secure the device to the bed frame. Good job. You guys did good. Good, 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 good. I believe you. So all right. So good job, you guys. Do the practice questions help? Yeah. Okay, cool. So yeah, so if we have time, we'll do practice questions. I can do Saunders next time. I just like just picking different stuff so like it's not getting like the same questions over and over and over again. All right, guys. So next week is week 8. Just trying to remember what's due. Just your discussion question this week. And then there's no quiz next week. Okay. The next quiz isn't going to be until week 9. So get your discussion question. Have a great weekend. Enjoy your holiday. Hope you guys get some rest and good stuff. And I will see you all next week. Take care. Be safe.
Thank you. Bye.
You're welcome.
Thank you.
You're welcome. Jamalatu, don't hang up.
I did not hang up. I don't know why I was out of the meeting.
I will wait a second. Do you need something to it? You're on mute.
Sorry. Yes, I want to talk to you.